Hey everyone, Dr. Wang here. Today I wanted to talk about Dutasteride, or what it is, how it compares to Finasteride, the pros and cons of it, and if it might be a good fit for you for your male pattern baldness. So, Dutasteride is similar to Finasteride in that it is also a 5-alpha reductase inhibitor, which means it is a medication that stops uh, testosterone from being converted to DHT, dihydrotestosterone. Uh, for use in male pattern baldness, it's an off-label medication. The main use of dutasteride is for BPH, prostate problems. It's a much less commonly prescribed medication for male pattern baldness because it is off-label. So how does its workings differ from finasteride? So 5-alpha reductase, you have three variants. You have type 1, that's in the skin and the liver, type 2, that's mainly in the prostate, and also less significant but still present type 3, which is in the peripheral brain and breast tissue. So finasteride mainly works on type 2, which is just in the prostate. But dutasteride works on both of these, both in the skin, liver, and the prostate. So this is the one that is most interesting to most people who are using it for male pattern baldness. From a physiology perspective, the thinking is that because it's working in specifically in the skin with the type 1 5-alpha reductase activity, in theory it could be more effective than finasteride. So one of the biggest ways where finasteride differs from dutasteride is the half-life. And the half-life is the point in time where half of your circulation dose is processed and eliminated. For finasteride, the half-life is 6 hours, so you can see it's relatively short. Whereas for dutasteride, the half-life is actually 5 weeks, so much longer. Another thing to know is that it takes 5 half-lives to reach steady state, which means steady state is basically when your levels in your blood sort of reach the peak levels for your dose. And this long half-life will be both a pro and a con when we talk about that a little bit later. Also, notably, dutasteride is more potent than finasteride. So while taking these medications with dutasteride, you can expect up to over 90% suppression of serum DHT levels, whereas finasteride is approximately 70% suppression of serum DHT levels. Pros of dutasteride, because it has a longer half-life, much longer than the 6-hour half-life of finasteride, it's going to stay steadier through your system throughout the day. People will get less mood swing side effects than they would have with finasteride and fluctuating DHT levels. And it could also mean that possibly more effective at reducing male pattern baldness as well. There are some studies that have shown in comparing dutasteride with finasteride that dutasteride is more effective in treating male pattern baldness, and also with actually a similar side effect profile. Physiologically, because it specifically works on the type 1 in the skin where hair is at, in theory, dutasteride is more effective overall for male pattern baldness. Anecdotally, people are also reporting it to be more effective. Online, you can see many reports of people experiencing a secondary shed and more growth as if they just started a medication again for the first time, like when they first started finasteride. But this is in the context of changing from finasteride to this dutasteride and getting this second reshedding and more hair growth. Cons of dutasteride. So, if someone's taking finasteride and they get side effects, Because the half-life is so short, if you stop the medication, your serum DHT levels will just come back to normal in about 14 days. So, well, for most people, stopping the medication will usually get rid of the negative side effects. However, with Dutasteride and the very, very long half-life, it could mean that you are going to be stuck with the side effects for a long time as it slowly flushes out of your system. Not only that, but because it takes 5 half-lives to reach the steady state in your body, what it could mean is that you don't really see these side effects until the 25th week mark is possible. And what that means is that you could get side effects later, and these side effects could persist longer even after you stop this medication. So, in summary, what does this all mean? Well, if you are not taking finasteride or dutasteride and you're wondering which one to start, I would recommend you talk to your doctor about starting the finasteride first. Mainly because if you find out you have side effects, it's going to be easier for you to stop that medication and try to reverse some of those side effects. Also, if finasteride works well for you, then you never have to go up to the dutasteride. Other things, for someone who is already on finasteride and are tolerating it well, not really having any side effects, but are still having a lot of male pattern baldness, then I think it could be worth talking to your doctor about possibly changing to dutasteride and seeing if it's a good fit. You have to keep in mind that this is a much longer acting medication, and if you do get side effects with it, you could be stuck with those side effects for quite a while. So thanks for listening to my video today. Next video I had in mind is to do something on minoxidil. It's another hair loss medication that works very differently from these 5-alpha reductase inhibitors. Also planning some other side videos as well on a lot of other different things. So thanks for listening.